A very good morning, Dr. Randeep Wadhawan, and thanks for doing 5 questions with Medsolin, sir. Your question number one is, sir, how many successful surgeries in all you have performed in your career till date?
So, in my more than 25 years of experience in the field of surgery, I have done more than 25,000 successful surgeries, and which go across all specialities, particularly my field of minimal access surgery, bariatric and metabolic surgery, treatment for type 2 diabetes, and gastrointestinal surgery.
That's great, sir. Thank you. Your second question is, what are the top risk factors that the patient is made aware of before going into surgery?
So we get patients from all across the world with multiple problems, and that's why we are referred patients, because we are a referral center. We are a tertiary care center. We have patients coming in with cardiac issues, with pulmonary issues, requiring multidisciplinary teams. So we have a multidisciplinary team here which can take care of almost all medical problems so that the person or the patient is made fit for a surgical procedure. And once the person is made fit for the surgical procedure, then we offer the best treatment which is available anywhere across the world.
Thank you, sir. The third question is, what kind of post-surgery support do we offer to patients?
So we have a fantastic support system. It's not just doing surgery. It's basically providing an excellent support system, and which basically is availability. So we are all available. I'm available along with my team of 5 more surgeons are available. We have a dedicated specialty nurse. We have dedicated physiotherapists, nutritionists, just to ensure that our post-bariatric, post-GI surgical patients receive the best possible post-op care, because the recovery is all based on what kind of care is offered to these patients. Subsequent to once they are discharged from the hospital, we are again available on WhatsApp, on emails, so that once they go back to their own countries, they are always available, just a phone call away and just an email away, so that they feel comfortable and they feel that yes, the doctor is right there in our neighborhood and he's not like several thousand kilometers away. So that's the kind of support that we intend offering to almost all patients, particularly patients coming from across the world.
Pleased to hear this answer, sir. Thank you so much. Next question, which will be very interesting because as you mentioned about your experience, sir. So we'll talk about that. So let's say, sir, in your 25 years of experience in bariatric and GI surgery, what was the most interesting case you have come across, sir?
So we've encountered several interesting cases in our career, because 25 years is a pretty long time, and obviously you come across several interesting cases. First which comes to my mind is a 300 kg lady, a young lady, 32-year-old, who came in from Middle East, and she was 300 kgs. Even the activities of daily living were on the bed. She wanted help, and we offered a bariatric surgery for her. Of course, the patient had to stay with us for almost 2 weeks, but once she left, she was very comfortable. She came by taking 2 seats in an aircraft, and when she went, she was just on one seat. And and this has been almost 6-7 years when we operated, and she's lost significant weight and doing extremely well. Some of the other patients that we've operated are a certain gentleman who came with a large adrenal tumor. We operated this gentleman, and it turned out to be the heaviest adrenal tumor ever operated in the world. So we've got that in the Guinness Book. Then we operated these 2 gentlemen. A gentleman came up with a type 2 diabetes and obesity. We operated and ensured that his obesity is fine, his type 2 diabetes goes under remission. Then he got his son for a surgical procedure, a bariatric surgical procedure. We found that his kidneys had failed and he required a renal transplant. So his father, who we had operated earlier, donated the kidney to the son. And then after his renal transplant, we operated the son for a bariatric surgical procedure. So again, this would be one-off case wherein both father and son operated, and the father donating kidney to the son. Another interesting case which comes to my mind, and this came from Africa. This gentleman walked in, and he had a large rectal tumor, and we offered a robotic GI surgical procedure to him. We do a lot of robotic GI surgery as well. and the patient got cured, went back to his town, and since he was cured of the surgical procedure, he started regaining weight, and yeah, 3 years later he comes with a huge amount of weight, and then he wants a surgery for a bariatric surgery for his weight. So this is one off case wherein a gentleman is operated for a cancer surgery and comes back for a bariatric surgical procedures, and both procedures done very successfully. So these are some of the interesting cases that we've handled from across the world.
Wow, so the list is really long, and pleased to hear it. As you mentioned, so that's the last question. As you mentioned, this hospital being the referral center. So I would like to ask you that how are the healthcare technology and treatments in India are rated across the world, sir?
So today, India would be rated as high as any other Western worlds as far as the treatment and medical treatment is concerned. It's a huge market which patients come in here, get their treatment, and go back very happy. One, the expertise is available because the volume of work that we all are doing is huge. Number two, the technology is available. What is available anywhere in the world is available here. When we look at our branch, almost the endovisions, the energy sources, the robotic, the latest robot, everything's available. So, and everything's offered to the patients. And the third and the most important thing is all this comes for a much more reasonable price as compared to the Western counterparts. And therefore, when we sum it up, we find the expertise, technology, and the cost. So India is a destination for medical tourism.
Thank you so much, sir. Thanks. Have a good day. Thank you.
Thank you.